Okay, thank you everybody for joining us. Good morning and welcome to those who are viewing online. Our government was proud to launch the Healthcare Action Update last year, where we announced and provided updates on initiatives that are improving access for Newfoundlanders and Labradorians. Through these updates, we kept you informed on family care teams, and there are currently over 50,000 people who've now been connected. We've kept you informed on how we are addressing surgical backlogs with same-day surgeries, Heart Force 1 fly-in, fly-out cardiac cath procedures, and expanding the traveling orthopedic team. We've also updated you on the ongoing recruitment and retention actions, including updating nursing regulations, which have seen more than 400 nurses and more than 70 physicians recruited since April 1st. We also shared how we are using technology, a recommendation from Health Accord NL, to make managing your health care easier. We expanded emergency virtual care, which will see more of our rural emergency departments able to stay open. We provided virtual primary care to those on Patient Connect. And we started the pediatric continuous glucose monitoring pilot program so that children and their families can best manage their blood sugars. We also expanded automatic notifications so that you get electronic reminders of your appointments rather than relying on paper or letter. If you need to update your contact information for those electronic reminders, I encourage you to phone 1-877-336-4170 so that Newfoundland and Labrador Health Services has your most up-to-date phone number, email, and address. So all of these initiatives give you better access and control to your health care. Today, at the update, we are pleased to announce another access point. We are very excited to announce we are launching a new digital access to your personal health record called MyHealth NL. Newfoundlanders and Labradorians will have access to some of their personal health information when and where they want to view it. It will be viewable on computers and cell phones as long as you have internet access. MyHealth NL includes strong security protocols and safeguards to protect your health information. Starting February 1st, the personal health record will be made available to a group of 5,000 Newfoundlanders and Labradorians over the age of 16. And starting in the spring, we anticipate another 50,000 people will be added each month. Your personal health record will let you see laboratory results, radiology reports, except for the images, dispensed medications, and allergies, to name a few. We are also developing an app which will launch later this spring. Initially, the new app will incorporate a personal health record and provide that access to your health information. And over the following months, the app will be updated to provide additional features such as the ability to book medical appointments online and a service to assist in navigation through your health services. The new service will benefit patients, but it will also be a benefit to physicians. We have consulted with the NLMA and will continue to do so as the service is developed. The new service will help reduce administrative burdens for physicians and primary care providers by allowing residents to receive their health information through the app. One example is physicians will be able to provide an electronic requisition as opposed to a paper copy of that requisition, reducing the need to reprint in the event the paper copy is lost. The personal health record and the app mean that residents will be able to view test results so they are more empowered to take an active role in their own health. Residents can share their health record with others that may need it, such as a caregiver, family member or loved one, and the ability to track referrals, which will be available through the app and reduce the administrative burden for physicians. The personal health record is your window into the information that your healthcare providers see and that can be more involved and knowledgeable about your own health. I'll now turn it over to Steve Greene for comment.
Thank you, Minister Osborne, and good morning, everyone. On behalf of Newfoundland and Labrador Health Services, I'm pleased to be here to share the details about MyHealth NL, a secure online personal health record. Newfoundland and Labrador Health Services is committed to transforming our healthcare system to one that is modern and accessible. Providing digital access to your health records is one of the key steps in this transformation. People have been using their computers and phones for years to order groceries, manage airline tickets, and research health symptoms. It's time that your health care was that convenient to manage. MyHealth NL will make it easier to do that. MyHealth NL is a secure website that enables people across Newfoundland and Labrador to access their personal health information online. The personal health record is the first of many planned health services that will be offered through an app which will be available to the public this spring. The app will provide a central access point to digital health services such as scheduling medical appointments, receiving virtual care, and checking your health care symptoms online. Other features such as health system navigation and a virtual assistant or chatbot are expected to be added to the app throughout the year. Starting next month, a small group of 5,000 people aged 16 years and above will be invited to participate in the initial rollout of MyHealth NL. Once invited, you can set up your account by logging into MyGovNL, which is a secure government website. From there, you can select the option for personal health record. To access your personal health record, you will need to have a government-issued photo identification card, so your license or photo ID, as well as having MCP connected through the MyGovNL platform. You will also need a valid email address. Once verified, a unique activation code will be mailed to you. This activation code is required for your initial login to your personal health record. Once set up, users will be able to view their lab test results, X-ray reports, dispensed medication from community pharmacies, and allergies. You will also be able to grant access to your personal health record to family members and trusted caregivers so that those in your circle of care can support you through your health journey. In addition, users can also access mental health and health information resources. Once the initial rollout is completed, more people will increasingly gain access to MyHealth NL until all residents of the province are eligible to view their personal health records online. We are aiming to add 50,000 people every month until everyone has access. MyHealth NL provides secure digital access to key medical information for patients and their families. The ability to review test results and medications without a primary care provider appointment, and the ability to be more engaged in your own health care. In closing, I would like to thank the staff at Newfoundland and Labrador Health Services, the Department of Health and Community Services, and the Office of the Chief Information Officer who have been working hard to make this possible. I will now turn it over to Dr. Parfrey.
Hello, everybody. I'm just going to speak to the relationship of these initiatives to recommendations coming from the Health Accord. And you may remember that we really did strongly believe that virtual care was a necessary and good type of care to get for this province in particular instances, and that it was dependent on having health information systems available to us that allow these things to happen. So I'm going to give you an example of how virtual care can be very beneficial to being able to stabilize patients. In 2022, we provided through our heart failure clinic 1,800 visits to stabilize patients, and it took 6 months to stabilize them. In 2023, we added in the virtual care option, and the number of visits increased from 18,000 to 3,000, and the proportion of virtual visits changed from 10% to 27%. And the patients were stabilised in 9 weeks compared to the usual 6 months. And patients from all over the province were enrolled who wouldn't be able to access specialist therapy. So I think that's a good example of the capacity of virtual care to help individual patients. So the second point I want to make is around health information. And in recent years, the concept of a digital front door for people, that they could actually get into their information, their health information, get electronic appointments, and navigate the health system has become more popular. And there are two ways of doing that. One is through the website, MyGovNL, and the second is through an app. So my point here is that it takes time for policy to be translated into implementation. So starting with the web access in February, but really the most interesting goal will be to create an app that allows a person to use their phone to access their health information. And that piece will come through in the next number of months. So I'm probably saying that you can't get everything instantly. It takes time to implement policy.
Okay.
Thank you.
Open for questions.
So, how much do you expect this may alleviate the administrative burden on doctors who may spend a lot of time now notifying patients about results that are just normal, but, the patients are sitting there wondering, is my result back? Is it anything bad? And they wanted to have that information.
We believe that it will certainly have an impact. In consulting with the NLMA, they felt that this could certainly assist in alleviating administrative burden. For example, medication profiles will be available real time on the app once it's up and running. In terms of lab work, it'll be 1 week later to give the physician an opportunity to view it first. Medical imaging will be 2 weeks later to give the physician an opportunity to view it first. If the physician feels that there's an urgent need to contact the patient, they have that lag time. Otherwise, the information is available on the app to the patients directly. So that would relieve some administrative burden for physicians, where they wouldn't need necessarily to contact the patient if the results weren't urgent to relay to the patient. That's one example. The requisitions that I talked about earlier, there are a couple of concerns with the requisitions. Oftentimes people lose the paper copy of the requisition and ask the physician's office to reprint those. If you're looking for blood work, for example, anybody who's gotten a requisition for blood work, the physician simply ticks a number of boxes. Once the paper requisition is in the hands of the patient, the NLMA have had concerns where some patients may tick some additional boxes that weren't requested by the physician. The electronic requisition will ensure that those requisitions cannot be tampered with once they leave the doctor's office. So it does relieve some administrative burden, certainly for physicians. Those are just some examples. I can certainly ask Steve or Pat to speak further to that.
Yeah, in terms of, I guess, what's available inside of the app, the intention is to do a rolling wave of updates inside of the app, and that would include the addition of it could be additional medical results, it could be health symptom checkers, it could be system navigation. So we are looking at a number of different additions throughout the year, in addition to what's going to be available in the initial launch in February.
I want to ask about who do you think is going to benefit most from having access to this information?
We have over 300,000 individuals now who have access through MyGovNL. They've applied and are actively using MyGovNL. So that's the vast majority of individuals who, when you take out the fact that children wouldn't, for example, so the vast majority of the population that can use MyGovNL. So those individuals will be the first to have access as they work through MyGovNL because they're already registered. We do anticipate, as MyGovNL continues to receive additional services such as this, that anybody who hasn't applied but have the ability to may apply. So the short answer is, almost everybody in the province, if you have access to MyGovNL or a smartphone, will have access to your own personal health information once you apply and log in, and the numbers continue to grow, as Steve outlined earlier. Anybody else who doesn't have the technical ability to log in will also benefit, because as people log in and are using this, the wait times for those who are not able to log in will be shortened as well. So this will benefit everybody, whether you have a smartphone or not.
What's the cost associated with doing this?
So it's about $1.2 million a year for the personal health information aspect of it, and I believe it's $6 million to develop the app. Steve?
Yeah, that's correct. There's $6 million reserved to build the app portion.
I'm just going to respond to the prior question about who might benefit from the my personal health record electronically, and I think people with chronic diseases will very much benefit, because they probably understand their blood work, they understand what's been followed, and they understand the test is specific to them, and for them to be able to reassure themselves about that their disease is not changing in any particular way will be a great benefit to them.
Yeah, if I could add to what Pat said as well, and I should have answered in the previous answer, but it will allow individuals to have more informed discussions with their primary healthcare provider, because they have access to the information through their personal health information. They can better manage their health because they have access to this information, and it reduces the burden of travel and wait times for individuals as well.
Can you walk us through how family sharing is going to work and what that means for somebody, say, as an elderly parent or grandparent that needs care, might not be able to access this themselves?
Yeah, absolutely. So I think Steve is the best to answer that. I will start by saying that any individual who grants access to a loved one or a family member, they can set a timer on when that access expires, but they can also go in at any point and remove that access should they want to do that. The individual who's been granted access goes through their own profile as opposed to the individual's profile, so they don't have access to their security code or login information, for example. But Steve?
Yeah, so when you log into the portal, there is a sharing option where that will bring up an administrative page where you can control who you share it to. One of the, in the initial 5,000 group, it's limited to sharing with one other person with a MyGov, with the same access within the MyGov portal. We are expanding that as we roll out the service, so you can share it with multiple different family members or providers, and you remain in full control as to granting the access or removing the access.
How will the government ensure that people's information is protected? Because the cyber attack is still fresh in everyone's mind. You mentioned the word security a few times. Can you explain how that'll work?
Yeah, I'll take that. So privacy and security of personal health information is of utmost importance to us. The personal health record leverages the highest privacy standards that we have, and people of the province can be assured their information is protected. There are a number of means that we use to do that. Obviously, privacy impact assessments, external vulnerability assessments, as well as leveraging the secure government ID platform. And it also evolves to even simpler things as to automatic logout of the portal if there's a period of inactivity. So there are a number of safeguards. We've had an external security assessment of this particular platform as well.
Pathology has been excluded from what people have access to. Can you walk us through why that is?
Just learning from other jurisdictions and best practices. At some point it may be added, but just learning from other jurisdictions who are using similar processes, that's been left out. And Steve, did you want to add to that?
Yeah, no, it's really starting the onboarding with the services that we're comfortable with in consultation with clinicians, and jurisdictions have typically stayed away from pathology in the across the country in the early releases, but it's something that could be considered later.
I'll just add there is that the pathology reports usually contain very specialised words that generally people don't understand, and they're looking for explanations from doctors as fast as they can get them. So I think that it's probably best at the initial phases to be able to access your pathology report with a doctor present.
What about the concern around, so if I have the full access to the test results, you mentioned the language used there, even for blood work, for example, there may be a bunch of things that people don't understand. Is there a concern that it may, in fact, end up with more people now calling their doctor because they get concerned about something that they see in the report that maybe isn't actually concerning, but because they're reviewing essentially the same data that the clinician has, that it may create some more confusion and concern?
I think that the initial selections are very conservative, and that the reports around imaging are just general radiology imaging, and the idea and the fact that CT scans and MRIs would not go on these sites until we get a lot more experience demonstrates how conservative the approach is.
We've learned as well, Peter, from other jurisdictions, Ontario just as one example, but there are other jurisdictions, not only in Canada, but in other countries that are using similar access for residents. And it's well received amongst the population. It is also well received amongst our healthcare providers. Just a couple of examples. I mean, you know, we've indicated that it will have a health system navigation tool once the app is up and running, a symptom checker, a health library, and an appointment scheduling ability. So one example of this, if you log into the app, you indicate that you feel you have urinary tract infection, the app can give you, help you navigate the health system. And as opposed to traditionally, folks would probably go to the emergency department, some probably still do. You know, you can actually have that symptom looked at and diagnosed by a pharmacist, and the pharmacist can then prescribe. So it will help you navigate the health system in many cases. You know, not 100% of cases, but in many cases will allow you to navigate and provide you with recommendations in terms of where you can obtain services. Steve, did you want to add to that?
Yeah, we're investigating a number of different things. One, a couple of comments I'd make there. One is around the health system navigation and the health libraries. There's a routing component to those. So if you have symptoms and you go in and look either at the health library component or go in through chatbot type functionality, the routing piece is something we're highly interested in, where it may say Emerge is the best spot to go, but it might in parallel, it might also say something different where, depending on what your symptoms are, it might say you can actually get that service from a pharmacy and provide advice around where the local pharmacies are. So there are a number of different things that we're looking at adding to the portal.
Who's building the app?
Steve can also expand on this, but it is through the Provincial Health Authority and what was formerly known as NILCHI, which is now part of the Provincial Health Authority. So it's been done in-house, and there will be probably external expertise added to that.
Yeah, we are looking at external expertise, leveraging an existing solution that we already have that's been providing this level of access for clinicians, physicians already. So there's an existing component. What we're doing is expanding that capability to be for the residents of the province.
Minister, I know responsibility for contract talks lies with Treasury Board, but Allied Health has had their conciliation with the province breakdown. As Health Minister, what's your reaction to that, considering that they have already described the healthcare system as in crisis and used the word crumbling in their release? So what's your reaction to that?
So obviously, as Health Minister, we'd like to see a resolution to this between Treasury Board and Allied Health. Our focus is on ensuring the delivery of healthcare services to Newfoundlanders and Labradorians. Having been the Minister of Finance through 2 rounds of collective bargaining, and 2 sets of contracts with Allied Health. I can say that the job of negotiating is best left with the President of Treasury Board, the Minister of Finance. So I won't delve into that arena because, you know, discussions between the 2 parties, I'm not privy to all discussions, and best not to delve in and perhaps jeopardize those discussions.
Yeah, but what would the optics of any sort of job action or strike look like for the province, considering so many people are concerned about healthcare and accessing it in the first place?
I do understand that Allied Health are looking at as well as Finance and Treasury Board, essential services. The Provincial Health Authority will also ensure that essential services are in place. If there is a situation, the Provincial Health Authority will have measures put in place to ensure that we continue to provide the health care to individuals of the province.
We spoke with the Registered Nurses Union earlier this week, and they said that they've been asking for the vacancy report since the fall, and they haven't received it yet from government. Why haven't they been able to access that?
Well, I found out that Yvette Coffey was looking for it and hadn't received it through the media. I hadn't heard from her directly, but when I did hear this through the media, we ensured that staff in the department and the Provincial Health Authority are able to compile that information and get it to her. We also, I know that the Vice President responsible at the Provincial Health Authority will be reaching out to Yvette Coffey today to look at the numbers. What I can say, as we've indicated here today, just recently I'd been saying that there was approximately 370 nurses recruited since the 1st of April, the beginning of this fiscal year. That's now over 400 nurses that have been recruited to the province. So the VP at Provincial Health Authority will work through those numbers with Yvette today. But I can also say that between October of 2022 and October of 2023, which is, we measured in October, April, and October again. So there was a small reduction between October and April in the number of vacancies. We've seen another reduction in the number of vacancies for nurses in October of 2023. In October of 2022, we were over 750, I think it was close to 760 vacancies. It's now closer to 700 vacancies. So recruitment is complex. Part of the reason for that, there's a number of reasons, but part of the reason we have the largest band of the population, known as baby boomers, are now retiring. So we have the largest band of the population retirement eligible and retiring, leaving the system. So for the past number of years, whether you're computer technology, trades, whether you're a healthcare professional, there are shortages in all of these areas, largely in part because of the numbers of individuals retiring and leaving the workforce. So replacing those healthcare professionals or replacing IT individuals or replacing engineers has been just as challenging. But we've employed a number of recruitment initiatives. We've set up a recruitment office at the Health Authority, a recruitment office in the department. We are starting to get ahead of the curve, even though we still have the baby boomers retiring, and that presents challenges. We are getting ahead of the curve. We are reducing the number of vacancies. So as we recruit, while we have over 400 nurses recruited, we still have a number of nurses that have retired or left the healthcare system. But we have reduced the number of vacancies from almost 760 to, I think it's just over 710 vacancies, closer to 700. So we're getting ahead of that curve now.
Minister, are those 400 in the system working, or are they, saying, yes, I will come to work in Newfoundland and Labrador?
So my understanding is they're in the system. So One of the things that I will say, and again, you can't just say, okay, well, there's over 400 nurses recruited, so that should be a reduction of 400 vacancies. We still have retirements and we still have people leaving the system. There are still people that, you know, leave to work in the private sector or leave this province to go elsewhere. There are people that leave other provinces and come here. There's movement, but the number of vacancies is now starting to go down. It peaked last October, or October of 2022, it peaked at almost 760. I think it was 757 was the number, but almost 760. And we're down now closer to 700. So we are managing to get ahead of that curve. So the other aspect is, while you know, it sounds like there's 700 vacancies, I'll say the dirty word, travel nurses. Not all of those positions are actually vacant. We have people working in many of those, but they are travel nurses. I am focused on reducing the number of travel nurses, our reliance on travel nurses, as we are able to recruit enough nurses in the system that we no longer need them. But right now, it's a necessary evil. We need them to continue to provide health care to the people of the province. So while the position is vacant because they aren't, you know, directly connected to our health authority, they are still working in our health authority as a travel nurse. So they're not all vacant, but they're not filled with the people connected to the health authority that we want, and we're focused on and working towards filling those positions.
Thank you.
All right, thank you, everybody.